Administration of intramuscular epinephrine for anaphylaxis. Objectives. Upon completion of this lesson, the student should be able to define anaphylaxis, list common allergens associated with anaphylaxis, identify signs and symptoms of anaphylaxis, assess the severity of the allergic reaction, understand the guidelines for use and administration of epinephrine in the treatment of anaphylaxis, recall the 6 rights of medication administration, explain how epinephrine works in reversing anaphylaxis. Objectives continued. Recall potential complications of epinephrine, recall potential side effects of epinephrine, verify correct medication, dose, and expiration date, appropriately administer the correct dose of epinephrine utilizing the EpiSafe syringe, demonstrate evaluating the patient response to epinephrine administration. Anaphylactic reactions. An anaphylactic reaction is an extreme form of allergic reaction involving 2 or more organ systems that causes the release of chemical mediators which produce the following adverse effects: bronchoconstriction, vasodilation, capillary permeability, increased mucus production, hypotension. Common allergens. Food allergies such as peanuts and seafood. Insect stings such as from bees and ants. Medications, latex, molds and pollens, etc. Common signs and symptoms of anaphylaxis: shortness of breath, tachypnea, wheezing, stridor, swelling of the lips and tongue, hypotension, tachycardia. Assess the severity of the allergic reaction. Mild equals a localized reaction. Moderate, you have mild wheezing. Severe indicates anaphylaxis, which is a multi-system reaction with any or all of the following signs and symptoms: altered mental status, signs of shock, diffuse wheezing, dyspnea, stridor, swelling. Indications and contraindications for the administration of intramuscular epinephrine. Indications: for moderate to severe respiratory distress secondary to anaphylaxis. Contraindications: none in reference to treating anaphylaxis. Anaphylaxis treatment. Assessment and treatment. General medical assessment and initial medical care. Assess airway, breathing, and circulation. Administer oxygen at 15 liters per non-rebreather mask or 6 liters per nasal cannula based on the patient's degree of respiratory distress. Assess severity. Moderate to severe symptoms, administer intramuscular epinephrine per Southwestern Illinois EMS system guidelines. Approved BLS services should apply CPAP. Apply ice or cold pack to bite or injection site if appropriate. Intramuscular epinephrine dosing for severe allergic reaction, anaphylaxis. Epinephrine dosing for an adult. Patients greater than 30 kilograms or 66 pounds, you should inject 0.3 milligrams into the deltoid muscle of the arm. Epinephrine dosing for pediatrics. Patients less than 30 kilograms, 66 pounds, you should inject 0.15 milligrams into the deltoid muscle of the arm. Side effects of epinephrine. Potential side effects of intramuscular epinephrine administration: tachycardia, pale skin, especially at the insertion site, dizziness, chest pain, headache, nausea and vomiting, excitability and anxiousness. Response and duration of epinephrine. Response of epinephrine on the body. The response is very rapid, occurring within seconds. The duration of the epinephrine response is approximately 10 to 20 minutes. Epinephrine 1 to 1,000 vials. Flip the plastic cap off of the glass vial top containing the epinephrine 1 to 1,000. Aseptic technique of the epinephrine 1 to 1,000 vial. Wipe the vial rubber top with an alcohol prep pad prior to touching it with the needle. Allow time for the alcohol to dry. Preparing the EpiSafe syringe. Remove the EpiSafe syringe from its plastic wrapper. Hold the bottom of the syringe with one hand and grasp the cap on the needle with the opposite hand. Pull upward to remove the cap. Preparing the EpiSafe syringe. Withdraw either 1.5 milliliters or 3 milliliters of air from the EpiSafe syringe. Withdraw air from the syringe by grasping the barrel of the syringe with one hand and pulling back on the plunger with your other hand. Intramuscular injection of epinephrine 1 to 1000. Pictured below is the area of the deltoid muscle of the arm and a syringe being injected at a 90-degree angle into the deltoid muscle. Injection of epinephrine 1 to 1000 into the deltoid muscle. Completely expose the upper arm. You will give the injection 1 to 2 inches below the acromion process in the center of the deltoid muscle. Wipe the intended injection site with an alcohol pad, sweeping outward from the intended injection site in a circular motion. Allow the area to dry. Once the area is dry, administer the injection. Injection of epinephrine 1 to 1000 into the deltoid muscle. Hold the syringe with your dominant hand and place the syringe between your thumb and index finger. Let the barrel of the syringe rest on your middle finger. With your free hand, gently press on and pull the skin taut so that it is slightly tight. Hold the syringe barrel tightly and use your wrist to inject the needle through the skin with a darting-like motion into the muscle at a 90-degree angle. Injection of epinephrine 1 to 1000 into the deltoid muscle continued. Let go of the skin with your other hand and hold the syringe in place at a 90-degree angle. Pull back on the plunger slightly to make sure you did not hit a blood vessel. If blood comes back in the syringe, remove the needle immediately. Do not inject the medication. Dispose of both the syringe and the medicine. Repeat the procedure with epinephrine 1 to 1000 from a new vial and a new syringe. When you administer the second injection, do so on the opposite arm. Injection of epinephrine 1 to 1000 into the deltoid muscle. Push down on the plunger to inject the medicine steadily but not forcefully, as that could cause pain. Inject the medicine slowly to reduce the degree of pain. Once the medicine is injected, remove the needle at the same angle that it went in. Place gauze over the injection site. Dispose of the needle in an approved sharps container. Observe the patient's reaction to the medication. This lesson is now completed. Please proceed to the test on class marker. Thank you.